This was Molly Potts last November, 8 weeks after she'd caught COVID, holding on tight because she's so dizzy.
So we've noticed that if Molly gets a slight virus, the dizziness comes back.
When we meet Molly and her mum, they're at the Evelina Clinic at St Thomas's Hospital. It's a London-wide service, one of a handful of paediatric long COVID clinics set up for the severest cases.
She had a cold a couple of weeks ago and she was back to being really, really dizzy, but it just lasted a couple of days and then she was back to normal again.
In the room, the physiotherapist and occupational therapist.
And in lifts, my head goes a bit funny.
All lifts or particulars?
Some are worse than others, but like all lifts make it go funny. The week of a bank holiday, so when the Queen died, so like Monday I was feeling a bit grotty, Tuesday I was like dizzy, and then in the afternoon it got better but still a bit dizzy. And then Wednesday I think dizzy in the morning but not as bad as Tuesday, but not in the afternoon, and I was back in school Thursday.
And then it's totally gone since?
Yeah.
And Molly's condition meant she had to repeat a year of school.
What does school look like at the moment?
I'm learning new stuff, so it's not a repeat from last year because I'm repeating the year. I'm enjoying it.
And we have had a positive email from school about how she's integrated into the new year group, because obviously year 9.
Yeah, and positive comments from teachers in that email.
There was lots of things that she wasn't able to do because the fatigue was so bad. So last year her school attendance was only 10% across the whole year. So, you know, that had a big toll on her.
Okay, we're back in this tiny room again through here. Come on in.
Physiotherapy is a critical part of the package aimed at getting the patients back to normal.
So you just sort of sit up tall and then just relax it off by about 20 degrees, that's it. Posture, and then mouth closed.
It's not just about the school that's been missed or the friends they haven't seen or the games they haven't played. It's about not being taken seriously. And part of the problem is that the symptoms of long COVID in children are often different from the symptoms in adults. And there's another problem too. Nobody actually really knows how many have been affected. Estimates range from at least 2 to 14% of children who've had confirmed COVID-19.
Are you feeling out of breath on any other things that you're doing?
No.
Most recover. But Channel 4 News has now had exclusive access to this clinic for those struggling to get better. It's been set up by this paediatrician and psychiatrist.
I think there was a bit of a message around the time of the pandemic itself that children and young people were somehow spared from the worst effects of COVID, and that's true for the acute infection. But actually what we've seen is that they are affected, and sometimes really quite severely with long COVID in the same way that adults are.
So far, 216 cases have been reviewed by the multidisciplinary team.
I think that it does fit with post-COVID syndrome or long COVID.
A virtual weekly meeting is held. 65 have been referred to University College London Hospital and 59 to the Evelina.
The suffering is real, without question. We're dealing with children who were in school full-time over 2 or 3 weeks of having a COVID illness. They've gone from that to being bedbound, really.
It is early days, but already they have noticed a disproportionate number of their patients are on the autistic spectrum, an observation that could prove controversial.
About 50% of the children we meet have a diagnosis or a probable diagnosis of autism. And for me, that's a huge interest and question about why that might be the case. And then there's another question for me as a mental health professional that probably about 30 to 40% of the children we see are also suffering from depression and anxiety.
Why do you think the autism element comes into it?
Maybe that children with autism, have worse long COVID than children without autism. It may be there's something about children with autism who are very, very sensitive to their own bodies and to the symptoms in their own bodies, so that the nerve messages that detect how our bodies are working are much more powerful in children with autism.
And there is another worrying observation.
So what we've noticed is that despite the fact that there isn't any evidence to suggest that COVID shouldn't affect all areas of the population equally, we just aren't seeing children and young people from particularly ethnic minority backgrounds up in our service. Our assumption has to be that for whatever reason, they're not being able to access the services that they need to be able to support their recovery.
There is no test for long COVID, but it is described as the patient having persistent signs or symptoms which continue for 12 weeks or more and which can't be explained by another diagnosis. Molly is not one of the patients on the autistic spectrum. She is simply a teenage girl whose life has been blighted by this virus. But there is now some hope.
I think back to basically normal, about as normal as you can be after recovering from like at least 10 month long illness. So yeah, it's good. I'm enjoying just life generally and living and trying to leave long COVID behind.